Today, we're going to talk about something truly incredible, the science that lets us detect sickle cell disease, a really serious genetic condition, before a baby is even born.
So let's just get right to it. The big question on everyone's mind. Is it actually possible to know if a baby has sickle cell disease while they're still developing?
The answer is a huge, resounding yes. And what's really wild is just how precise these tests are. So, how on earth do we do it?
Well, it all comes down to the genetic blueprint. We have to understand the genetics of the disease itself, because that's the foundation for how all of this testing is even possible.
Okay, so let's get into the specifics. Sickle cell isn't something you catch, right? It's a genetic disorder, and it all boils down to one tiny specific error, a single point mutation in a gene called HBB. And because we know exactly where that error is, we can look for it with a ton of confidence.
So that one little mutation changes everything about the hemoglobin protein. Normally, you've got what's called hemoglobin A, or HbA. It keeps your red blood cells nice and round and flexible so they can carry oxygen. But with that mutation, you get hemoglobin S, or HbS, and that causes those cells to warp into that rigid C shape or sickle shape.
And this is how it's passed down. If you get one mutated gene from one parent and a normal one from the other, you're a carrier. You have the sickle cell trait. But to have the full-blown sickle cell disease, a baby has to get 2 copies of that mutated HbS gene, one from each parent. And that's the key difference we're looking for.
And that brings us to a really crucial first step, something that often happens way before a pregnancy even begins: carrier screening. This is where people can get a clear picture of their genetic risk and really plan ahead.
Okay, so let's look at the odds. If both parents are carriers, what does that mean for their kids? Well, with every single pregnancy, there's a 1 in 4 chance, that's 25%, that their child will have sickle cell disease. There's a 50% chance the child would just be a carrier like them, and a 25% chance they'll be completely unaffected.
You know, there's a fascinating reason this gene is more common in certain parts of the world. The sickle cell trait actually offers some protection against malaria. So, as you might guess, carrier screening is pretty routine for people whose families come from these regions. This knowledge is all about empowering families early on.
But what if you're already pregnant and you want to know for sure? That's where diagnostic tests come into play.
So there are 2 main windows for these definitive tests. The first one is pretty early in the pregnancy, between weeks 10 and 13, with a test called CVS. The second option, amniocentesis, happens a little later, usually between weeks 15 and 20.
Okay, let's put them side by side. CVS gives you answers earlier, which can mean more time to process and make decisions. Amniocentesis happens a bit later, but it has a slightly lower risk of miscarriage and is often called the gold standard for its precision. But as you can see, both are just incredibly accurate.
I mean, let's just pause on that number for a second. Over 99% accuracy. For a test done in the first trimester, that level of certainty is just a modern medical marvel. It's revolutionary because it gives families a definitive answer, not just a probability, so early on. It works by testing a tiny sample of the placenta, which has the same exact DNA as the fetus. And then you have amniocentesis, which is even more precise, over 99.9% accurate. This one works by testing the baby's cells that are floating in the amniotic fluid. It's about as close to a guaranteed answer as you can possibly get during a pregnancy.
Okay, I know what some of you are probably thinking. What about those newer, non-invasive tests you hear about? The ones that just need a blood sample from the mom? What's the deal with NIPT for sickle cell?
The short answer is, it's promising, for sure, but it's not quite ready for prime time as a diagnostic tool for this particular disease. It's still just a screening tool.
And here's why. The amount of the baby's DNA just floating around in the mom's blood is incredibly small. It's like trying to find a needle in a haystack. Now imagine that haystack is also made of very similar-looking needles. If the mother is a carrier, her own DNA can just overwhelm the signal from the baby's DNA. That's why any high-risk result from NIPT for sickle cell would still need to be confirmed by a CVS or an amnio.
So once a family has that definitive diagnosis, what's next? This is where that knowledge becomes an incredibly powerful tool for planning the path forward.
Getting a diagnosis before birth really opens the door to proactive care. Families can connect with specialists, plan to deliver at a hospital that's ready for the baby's needs, and make sure that life-saving treatments like penicillin are ready to go from day one. It also gives them time for those deeply personal decisions. And all of this leads to the ultimate goal, which is giving that child the absolute best start in life through early intervention.
And it's really important to know there's a safety net here.
In many countries, pretty much all newborns are screened for sickle cell at birth. So even without prenatal testing, a diagnosis is usually confirmed within just a few days.
But knowing early, whether it's before or just after birth, is an absolute game changer. Starting treatments right away drastically reduces the risk of the most dangerous complications of the disease, things like severe infections and strokes, the very things that used to be major causes of infant mortality.
And this quote here really says it all. The ability to identify these kids early has completely transformed their future. We're talking about dramatically improved life expectancies compared to just a few decades ago. It's incredible.
So this leaves us with a final thought to chew on. We've seen how precise genetic information can totally change the outcome for one disease. The question for all of us is, as this insight grows and grows, how are we going to use it to shape the future of health for everyone?